Hey everyone, welcome to another virtual MHI roundtable. I'm joined as always with my brother Carlos, and today we have the pleasure of having Dr. Luigi Palermo, who originally was born in Italy, has an extensive international medical background, practicing across Italy, Spain, New York, and Monterrey, Mexico. He holds 3 master's degrees in aesthetic surgery, regenerative medicine, and hospital administration, and is a world-renowned gynecomastia specialist. He also did a stem cell training in Miami, where he continues to refine and apply cutting-edge medical techniques. And last but not least, he's my most trusted well doctor for gyno because I went through his process, which we'll get into later. But without further ado, thank you for coming on board, Luigi. Happy to have you.
Thank you, Doc.
Absolutely. Thank you. Thank you so much, Miguel and Carlos. It's a pleasure and an honor for me.
That's wonderful. So I know you're busy in your clinic right now in Mexico. So again, thank you for taking the next 30 minutes to an hour to basically expose your work. I wanted to bring this to the surface for our clients because, as you know, we're a hormone clinic and gynecomastia is a real thing. It was a real thing for me until I got tired of it and I got it taken care of. And I'm flabbergasted by how easy the process was, and literally no pain, which was unexpected. So I wanted to start with, what are the biggest misconceptions about gynecomastia, and why do so many men delay the treatment instead of opting out for surgery sooner? I can speak for myself on that one, but yeah. Why do you see that?
I think that one of the first thing is people are afraid of getting surgery. So just as simple as that. People are afraid of recovery time, are afraid of complication, which, don't get me wrong, it have to be considered all the time that we have a surgery, right? But at some point, the delay in approaching this takes time. And I think it's related to, and I'm pretty sure we will touch base regarding taking some estrogen blocker at first. So we will talk about that maybe more specifically. But I really think that one of the first one of the first wall is the fear of surgery.
Right. Yeah. I you know what? For me, that there was definitely a little bit of a fear. So I can tell you hands-on, I did use estrogen blockers to break it down until I said, that's it. I'm done. I got to get this out. So completely. Spot on, man. Now, what about how much of a role does genetics play in developing gynecomastia, and how could it be predicted earlier in life?
Well, for sure, there is a huge role of genetic in developing gynecomastia, just like everything else. I mean, I always say genes don't lie. So at some point, yes. And these days, we do have even tools to establish prior to a treatment if we do have the genes with the tendency of aromatizing or not. So genetic play a huge role. In general, we can even see it early during the pubertal time, where some people develop in early stage gynecomastia, even though it's not related to the testosterone replacement therapy, right? Because it's their own endogenous testosterone. Of course, there are factors like responding to even insulin. For example, insulin response has been tied to developing gynecomastia, and of course, the body composition. At some point, some people who, unfortunately, for the reason that it is, have too much body fat or have the tendency to develop more gynecomastia because of the higher estrogen levels, but also of the deposit of fat in the breast or pectoralis area, right? Let's put it like that.
Right. That's interesting. Yeah, because what we like to say, if you're above 15% body fat, usually it could be overweight related, because the more fat, the more estrogen conversion you have. So yeah, you can tend to develop it.
Receptors.
Yes. But when you're 15% body fat or lower and you develop it like me, then we like to just, hey, there's a way to test genetically for it, but we just, I basically rule out that basically you have the gyno gene, because there's no reason at a body fat like me you should be having gynecomastia unless that's a pre-genetic disposition.
Yes.
And I got a quick question, Doc. Like, how many, I know, how many I mean, it's a little bit different because you actually do the surgery. So, but from our experience, and I just want to sort of corroborate with what you're seeing in your practice, it's quite rare. We may get a couple true cases a year where you get somebody with true gynecomastia. So not only do they have the gene, they have the breast tissue, and they have all of the symptoms. So, I mean, how many surgeries are you doing, like a week or a year? I mean, what's your perspective on the rarity or common occurrence of gynecomastia in men?
But are we talking about non-TRT related gynecomastia?
Well, I mean, you can
Or
give
in
me a little bit
general?
of both. I mean, when we say TRT related gynecomastia, it's something that it's exacerbating something that's already existing,
Yes.
obviously.
Yes. Let's say that we perform a procedure in people that have never taken TRT in their life. They just have it.
Right.
Sometimes they've lost weight, or sometimes they just have it genetically, or sometimes they developed that, in Spanish we call it botón mamario. I don't know the word in English necessarily, right? It's like that small amount of fat under the nipple. Okay, let's put it like that. And of course, people that have been on TRT for many years that have been developing that. I mean, the average is that we do several per week.
7 per week. Okay,
Yeah.
I mean, that's still a low amount in comparison, because like I said, I mean, how rare do you, because from our perspective, to find somebody who's truly gynecomastic, right? I mean, it's very rare to find someone who has a true gynecomastic gene. I mean, Miguel has had the gene and was on TRT for years and managed it for a long portion of that duration. I have, we have very similar genes. I don't have gynecomastia at all. I've never had any symptoms
Yes.
on TRT. So just from an general perspective, it's kind of rare to find men that have the true gynecomastia gene.
Yeah, he's not. I mean, again, remember that the statistic is difficult to make because I can only say the people that approach the clinic to do something about it. But there are so many more
Right.
that I know to do it.
Yeah. And I guess my question for you, for the listener, is also because we have a lot of people who are like obsessed with gynecomastia. They'll get a little nipple sensitivity, which is quite common,
Yes.
as you begin TRT, and they'll mistake that for gynecomastia.
Yes.
Right.
No. Gynecomastia is actually a growth of tissue. So it's not a nipple hypersensitivity. I would say this is going to happen, yes or yes, but it does happen even with just ACG, right? You don't even have to do the full testosterone replacement therapy. You can feel the nipple sensitivity even with just the human chorionic gonadotropin, right? So there's two different things. Gynecomastia is actually the growth of breast
tissue.
Right.
Right.
So that's the definition.
Yes. So is there any difference between puberty gynecomastia versus testosterone induced, or it's still the same thing? It's the breast tissue building there. Because for me, it was over the years. Again, I used estrogen blockers to break it down, but it got to a point I was like, that's it. I'm not doing that again. Because last time I did that, I told you I got mental fog. My joints hurt. I'm like, and I know it's toxic. I'm like, what am I doing, man? Just get this out of the way.
Let's say that from a surgical point of view, there's no difference.
No difference, right?
That's like that.
Okay.
I mean, surgically speaking, origin speaking, yes, of course. From etiological point of view, yes, of course, there is a difference. From a surgical point of view, there's not too much difference. What we have noticed is that sometimes the born gynecomastia or people that have gynecomastia without using TRT, the tissue is a little bit softer. On the other side, gynecomastia developed over the usage of TRT is a little bit harder. I mean, at some point, we always suggest, especially when it's looks a little bit strange to do a biopsy of the tissue, because
Right.
remember that even if it's small possibility, still even men can get breast cancer, right?
Right. Makes sense. Right. I said it codes for just information that shouldn't be in our bodies as men.
Yes,
So
yes,
interesting.
completely.
So, I mean, as you know, most men, when they get on therapy, they basically go after going on aromatics or tamoxifen or any other aromatase inhibitor. Why do you suggest not use those? Because, again, I always like to say it's a patch, it's a band-aid on the problem, but it's going to continue to resurface itself sooner or later.
Yes. Let's say that my take on hormone is an orchestra. You know, when you go to the theater and you listen to an orchestra. So
Yes.
you have 15, 20, 25 members of the orchestra, depending on where you're going, right? If you're going to an opera in Milan, more and more trained people if you go somewhere else. But even if there are 5, 7, 10, 15, if one musician is not in tone, time, you can know that there's something wrong, right? Maybe you
Right.
don't identify it immediately. So hormones have to be in perfect balance and equilibrium. So whenever we are working with any kind of hormone replacement therapy, that is actually the goal, to find the equilibrium in the hormone. Suppressing completely the estrogen, I don't think is the answer
Right.
to take care of the gynecomastia part. I'm not saying that those medications are bad, don't get me wrong. I mean, sometimes
Right.
they need to be used. But yes, I think it's bad to suppress the estrogen, that at some point, even we as men need estrogen for everything. I mean,
Yeah.
we are maybe manipulated a little bit thinking about that we only need testosterone. We don't. We need testosterone, we need estrogen, we need progesterone, we need DHEA, and we need everything, and we need everything at the right level for us.
Basically, we need every hormone that a woman needs, just in different profiles, just like
Different
women need the
proportions.
same hormones in different profiles, right?
Completely different proportions. Yes.
And just to go over some side effect, guys, Doc, let me know if I'm missing any. Estrogen, suppressing your estrogen is terrible for your bones. It can be a cardiometabolic risk. It's horrible for brain function because it gives you brain fog, joint stiffness, or like discomfort. It could cause people to have weight gain, loss of libido, erectile dysfunction. I mean, the list
Absolutely.
pretty much
Yes.
goes on, but those are the main ones that we see. So when you suppress estrogen too low.
Yes. One of the main problem is that many people do this without guidance from profession. So I would say that also this is a huge situation. I see many people. I have a gym downstairs that inject and take everything or anything because they read on internet, they saw on Instagram, they saw on TikTok, or maybe a trainer told them. And maybe some trainers are super well educated on the subject, but some other no. So when they come here, they've been taking so many things without a guidance that their body are truly
Yes.
suffering, right? So things have to be done properly.
Right. Which actually, could you explain? This is off, basically off the questions that I had, because now that I realize it, aside from just being, I'm tired of this and getting the mental fog and my joints hurting, I did realize actually, now that I think about it, that I used it 3 times to break down the gyno, and I was able to completely get rid of it. Like, meaning I would squeeze my nipples, I had no tissue. This time, although I broke it down, I still had pieces, as you saw, which eventually, in fact, guys, you'll see in a little bit, we're going to put on the screen my journey and the size of the gynecomastia I had, which was pretty impressive. So the point is, I wasn't fully to break it down. Is there a point where there's no return, where the tissue, that's it? There's no amount of estrogen blockers that will break it down.
Yeah, yes, there is. Let's say that there's no, how can I say, we cannot say when this is going to happen, But yes, once the size is too big, because remember that we're talking about receptors, and receptors get saturated. So no, there comes a moment where the augmented or hypertrophic tissue is too big and doesn't go back to normal.
Right. Okay. All right. So what does the surgical process involve? How do you ensure the best aesthetic and functional results for the patient?
I'd say that like any other surgery, we need to understand that it's a surgery, right? So there is some degree of invasion to the body. The procedure is performed in a hospital. Is performed in general, unless the patient wants it for some emotional reason, but in general, it's performed under sedation, which I think is twilight anesthesia, I think you call in the US. So you're not intubated, it's not general anesthesia. You are somehow relaxed through some medication applied IV. After that, we work with local anesthesia. Over the time, we have developed ways to achieve the minimum bleeding and pain. We do actually some blockage all around. We use some medication to decrease the bleeding in order to decrease the chances of hematoma, like tranexamic acid. I mean, there are several things that we try to do. Of course, those things are completely studied and approved. After that, we perform an incision depending on the amount of breast tissue, but also on the amount of extra skin, right? I mean, some people have a lot of skin. So once you take out the hypertrophic tissue, then that extra skin can hang. So depending on that, we need to make incision to retract, take out all the extra skin possible. One thing is important to understand. Some people come to me and say, oh, you can just do a liposuction in that area. Breast tissue cannot be liposuctioned, right? It has to be taken out because it's hard. It's not like the love handle fat. Doesn't
Right.
It's not the
So
same.
So in other words, you can't suck it out. You got to surgically cut it out, which is basically what you did. And it takes an artist to do that.
Completely. It has to be surgically taken out with a lot of care in order not to touch a certain vascular structure, in order to completely take care of the areola nipple complex. I mean, there are several things to be taken care of, not damage any of the perforant arteries. So there are many things to be considered during the surgery, but in general, it's a procedure that take, depending, let's say in an average time, 60 to 120 minutes approx, okay, 1 to 2 hours. And in general, the patient goes home the same day, just a few hours recovery, checking that everything is okay, that the patient is coming out from the sedation, and just go home. You have to take antibiotic, you have to rest, apply ice for a few days, and of course, all the other methods that you are an expert with.
Yeah, I took a cocktail of peptides.
So all those things are up to you. But from a strictly medico-surgical point of view, that's more or less the procedure. Most of the stitches we applied are absorbable, so they will just go away over weeks. Rest is an important part of it. Again, icing and taking the medication.
Okay, and in regards to recovery, I think I'm like, what, 4 weeks in or a little longer, maybe 5 weeks in? I mean, I'll show right on camera, 5 weeks in and I got nothing. Put over there, but there you go, nothing. So, yeah, listen, everything you said is spot on. And for those of you listening, it's pretty easy. Get on a plane, go down for a couple of days to Mexico, get a beautiful cocktail that will knock you out, and you'll wake up. I was really impressed. Again, I'll keep saying it, that at any given point, I never felt any pain, nor before, nor after, nor a day, nor 2 days after. I never felt pain, which that was impressive for me because it's trauma. You're cutting out tissue out of your breast, right? So, and, I was working out within, I know I was supposed to wait about 12 days. I was working out within a week. But
Don't send the wrong message, my friend, please.
yeah, don't follow what I do. But fairly easy. I gotta say, I was really impressed.
And Doc, I've heard before that there are people, because Miguel was right behind the nipple and it wasn't connected to any other structures, but some people it actually goes deeper than just behind the nipple, correct?
Yes.
Okay.
And that in the case, you have to make a way deeper resection, which means more aggression, which means a little bit more rest and recovery time. It's not the most common situation, though, let's be honest.
Right. Okay, so most people is right behind the nipple.
Yes.
But it could go, what I understand, it could literally travel up all the way here. Have you ever seen it, or you've only seen it around here?
Okay. Yes, but remember that the gynecomastia in itself, I mean, it depends what's causing it, because if it's either innate, genetic, or anyway has been developed, even with the genetic predisposition after exacerbating with the TRT is one thing. Maybe if people have been taking for other reason, estrogen therapy, right? Maybe for sexual preferences or whatever it is, those kind of hormones can induce a way more growth. And if that growth is uncontrolled, then we have to act. But in general, when we talk about going all the way to the lymph nodes, then it's not gynecomastia anymore, right? I mean, we need to understand until what point is expected and where or when it's not gynecomastia anymore, or is not gynecomastia only.
Okay, got it.
Biopsy and to check what's going on there, right?
Now, is it true that, once you do a gynecomastia surgery, if, I continue as usual my testosterone therapy, could I have a reoccurrence of the tissue growing back? Because I've read things that, hey, if they don't cut out the root completely of the gyno, it could regrow back. And I know you've done thousands of these surgeries. Have you ever seen that? Or maybe it does exist, but in your case, it's never happened.
Let's say that it can happen, yes. I haven't seen my patients back for that.
Right.
But it can happen, yes.
So it could regrow back.
Could regrow back, even if you took off the basis.
Even if you took the root of it, it can, wow.
It can regrow?
Yes, because remember that we still have receptors, and those receptors can be hyperstimulated over the years. Maybe it will never be the same as the beginning, but there is a chance of getting back, yes.
But wouldn't those receptors be on the tissue that you cut out?
Yes, but remember that what we take out is the hypertrophic tissue.
So it's the consequence of those receptors proliferating tissue growth.
Yes.
Okay, got it. Now, I'm assuming the reason why also you wouldn't see it in any of your cases, to not scare anybody, I would assume that you see that regrowth when it's like a bodybuilder using super physiological doses. So they're hyper stimulating these receptors and it could grow back. But if you go back to your therapeutic dose like I'm doing, I mean, I don't think we should see any problems.
Actually, when people are doing TRT properly and they are in physiological, maybe even a little bit more, but still in a good range, right? Not like the testosterone 14 men, which I've seen. I've seen people with rejected so much that sometimes I don't even understand how they keep walking, right? Because
right.
They have so much testosterone in themselves that it's not very appropriate for the body. But in a very physiological way, it shouldn't even happen, right? There is a genetic behind, but then once you take it out, it shouldn't happen again.
Right. Again, it all comes down to the artist behind the removal.
Of course.
And I know you've done.
Also help.
I know you did Jay Campbell. This is how I got to you. I got to give a shout out to Jay. He did point me in the right direction.
Jay, if you're listening.
In fact, ironically, when I was there, I went out to dinner with them. They were actually there, him and Monica. So I met up with them. But before I ask, first of all, before I close out, where could people find you if they wanted to do this therapy? Of course, guys, for those of you watching, I'll make sure on the footnotes of this YouTube or podcast or whatever we make it into to have Luigi Palermo's medical contact information, but if you want to share where they could find you, you can.
Oh, I think that the best way is on my website, timelessbeauty.com.mx, and there is a formulary that you can fill in and send it get to us. I mean, of course, I'm not the one responding, or at least not always. Sometimes
Right.
I'll see some question when I'm free and I answer, or if my reception assistants have questions regarding it, then I step in.
Right.
To answer. Most of the time, especially with international people, we set up Zoom call, video call, at least for a first approach.
Okay.
At a minimum cost, and after that we establish the procedure, and there is the explanation of everything, because we need the blood test before and several things to be taken care of.
Beautiful.
And then we do them.
So I'm just thinking for our clients here in the United States, it's as simple as go to timelessbeauty.com, submit your information. You'll eventually get a free consultation to discuss if you're a good candidate. If you are, you get basic labs wherever you are. So you come ready to Mexico. Take a 2-hour flight if you're in Miami, like me. Literally land in Mexico. The hotel is decent. It's maybe 10, 15 minutes from the hospital where I got my surgery done. You're back to your hotel room within maybe 5 hours, 4 hours, because I remember I was in bed, sedated for a while, but I think that's because I took methylene blue. So my ability to break down neurotransmitters was longer. So that's why I was bedridden. But the point is, I was back in my hotel, and you do recommend before you fly back, just to be on the safe side. I think it was 3 days at least, which is what I stayed before I left. I mean, you could travel, but you're just concerned about hematomas, and it just makes sense if you're the surgeon, get the surgery, stay there for 3 days, enjoy Mexico, eat some good food. The food is delicious in Mexico, and then get on a plane and go back home. Right?
Yeah. At least 3 days, sometimes even a little bit longer. And yes, I mean, of course, hotels, there are plenty here everywhere. So they can be even, there is one across the hospital, one on the side of the clinic. So it's pretty easy. Even the blood tests can be performed here. Of course, if we have some extra day, you can come here, and we have a first meeting, and then we can perform the blood test. It's actually ready in 1 day. I mean, half a day, we can have the test. If we do it in the morning, by noon or 1, we have the results, and we perform the surgery the day after or 2 days after, depending on. It's important to rest after the procedure, right?
Right. 100%. I agree. So guys, the reason why we had this podcast with Luigi, again, he's the surgeon for Jay Campbell and for many other people, but more than anything, trustworthy professional that's done thousands of these surgeries and knows what he's doing. You'll see on here anytime soon a video of me, and you'll see again the size of my gyno and my process. You'll probably hear me say some funny stuff. I was sedated. I have no idea what I was saying, but it was pretty funny.
What's up, guys? So I'm here with Dr. Luigi Palermo. I'm about to go under on my gyno surgery with the best of the best. See you later.
What's up? I'm back. It felt like it was 2 minutes. Apparently it was 2 hours, but everything looked and came out good.
Spectacular.
The process felt painless. I feel great. Took a beautiful nap. Now I'm back.
This is a special nap.
And I'll have no nipples. Gynecomastia is about taking out the nipples. So I'll never have nipples again. Thank you for catching that moment. And before we close out, Luigi, is there anything else that we may have left out that you want to share with the audience?
No, mainly that. Don't be afraid to come.
Right.
Sometimes it's important too. And I understand that there are many things people say, but again, there are very good people, very good doctors everywhere in the world, and very bad too, right? So at some point that bad things can happen everywhere. I think, I don't know the actual pricing in the US, but I'm pretty sure it's way more accessible and doable here, and the medical care here is extremely good too. So nothing to be afraid of.
Thank you for bringing that up. Before we close out, I definitely have to say that, yes, I went to you not because just it's more affordable. It's more about finding a trustworthy doctor. And, you know, Jay spoke highly of you. I saw his results. I'm like, I got to go see this guy. And then I looked at the actual pricing in the United States. Could be anywhere from $8,000 to $15,000, depending on the facility. And obviously, I'm not going to say price because everybody's slightly different, but much more affordable down in Mexico. But more than anything, to be honest, what I realized of going down and seeing you, I'm just 2.5 hours from one of the greatest places in the world with delicious food. You go for your process, spend a couple of days there, enjoy the food, enjoy the atmosphere, and then come back home. Very simple.
Yes.
Yes. Well, thank you again, Doc, for
Thank you, Doc, so much for your insight.
Miguel, Carlos, it's been a pleasure and a honor. Thank you so much.
Thank you. And for those of you at home, not at whom, thank you for tuning in and stay healthy and
God bless.